I decided to watch myself give birth when I had my third kid. Okay. You can watch yourself give birth. They will give you a mirror so you could see what's going on as you are giving birth to your baby. I already had 2 other babies, so I thought I knew what to expect. But once I saw the mangled mess down there,
I'm talking downtown,
I was shocked and didn't know what to say. So, as I saw my son's head emerge, I looked at my husband and said, "Look, there's the sperm you left in there." Definitely a memorable birth. LOL. Is it considered a dad joke if the wife says it?
Welcome to the ER, ma'am. How can I help you? It's my son. He developed a rash today. Well, it doesn't look like he's having any trouble breathing, so that's good. I'm just so worried. He's never had anything like this before. Does he have any allergies that you know of? No. Any new pets or animals that he's been around? No. Have you been using any new soaps? No. When did you notice the rash? Right around this morning, after breakfast. And what did he have for breakfast? Some blueberry waffles. 6 to be exact. Has he ever had blueberry waffles before? No. Never. He might be allergic to blueberries. But that's not possible. His rash isn't blue. Right? Let's just get you guys back. We'll figure it out.
If you hear your name, please follow me. Tough Kane. Tough Kane, are you here?
I think you mean Tony.
Tony?
Yeah, Tony. Don't worry about it, man. No one gets it right the first time.
I wonder why. X10? Is there an X10 here?
It's Kristen.
How is that Kristen?
Seriously? Christmas, also known as Xmas? X is short for Chris.
Chris 10.
Present.
Leah? Is there a Leah here?
Oh, that's probably me.
You're Leah?
It's Ladasha.
Of course it is. Everyone follow me. When I had my first child, my husband was visibly uncomfortable in the delivery room. Okay? He's an old school guy, so the fact that he was even in the room was a big deal. Dad's doing the bare minimum? Good job. He was the most excited when he heard 8 pounds 22 inches. That's a big baby. He said, "Oh my God, that's a good sized salmon." It was instantly quiet. I could hear everyone's necks snap as they stopped what they were doing and turned to look at him. I burst out laughing, and then everyone in the room started to laugh. He finally got into it. That's a big time salmon. Can you imagine this husband's Tinder profile picture? Just him and an 8-pound salmon? You knew what you were getting into. This time, he could change the picture of a salmon to a baby. Swipe right.
Welcome to the ER, sir. How can I help you?
I slipped and fell on a water bottle.
Oh.
It's stuck in my butt and I can't get it out.
Is it a plastic water bottle?
Yeah.
Okay, we'll get an x-ray to see where it is, and then we'll help you get it out. Hello?
Hey, Austin. You should look at the x-ray for bed too. Water bottle butt guy wasn't exactly telling the truth.
What the? Sir, we got your x-rays back.
Do you see the water bottle?
We see 2 water bottles.
What? Oh! That's right! I have 2!
How did you forget that?
I put the first one up a few days ago. I guess I forgot. Can you get them both out?
Yes, the surgeon's coming down to talk to you right now.
Okay. Thanks! Welcome to the ER. How can I help you?
My knees are killing me.
Oh wow, they're really swollen. When did this happen?
4 days ago? It's starting to get hard to walk today.
I'll get you a wheelchair. Any past medical history, surgeries, or allergies?
Just diabetes. And I'm lactose intolerant, which is why I think this is happening.
Why would that have anything to do with your knees?
Well, I wanted my bones to grow stronger, and I've always wanted to be a little taller, you know?
And?
So I started using my insulin needles to inject low-fat milk into my knees.
Low-fat milk? Why?
You think I should have done whole-fat milk?
No! No milk! Why would you put milk in your knees? Who told you to do that?
It's supposed to be good for your bones.
When you drink it? Your knees are clearly infected. We have to drain them before you develop septic arthritis.
No, don't drain them. The only reason this is happening is because I'm lactose intolerant.
What do you expect us to do then?
Just give me something for the lactose intolerance and leave the milk in there. Please. I have a date this weekend, and on my dating profile, I put that I was 2 inches taller than I really am. I'm hoping the milk kicks in by then. Help! What's going on, ma'am? She's going into labor. I'm her midwife. Oh, shoot. I knew I shouldn't have come out here. Ben, call labor and delivery. I need a vomit bowl. Here's a vomit bag. Someone get me a wheelchair. No, that's too small. I need something bigger. It's okay, honey. If you need to vomit, just vomit into the bag. It's not big enough. If you need a second vomit bag, I will get you one. Will someone get their ass out here right now? No, it's not gonna fit. What's not gonna fit? The baby. I need something to vomit the baby into. Oh, honey. It comes out the same way it went in. It's not coming out your mouth. What? Where is labor and delivery?
Hey, Bob. How's the first week of residency going? Great. I think I'm really getting the hang of things. Yeah, listen, did you order 10 milligrams of Ativan to be taken 3 times a day for a patient in room 5? Oh, Miss Cindy. Yeah, I did. Why? Is that a lot? Bob, you ordered enough Ativan to put down a horse. That's how much the patient says they take. So I gave it to her. And you didn't think to question her? I don't understand. Why would she tell me she needs more Ativan than she actually does? Well, believe it or not, patients sometimes like to push our limits to see how much they can get out of us. No, they don't do that. Do you know what that much Ativan could do to a person? No. What are you doing? Getting ready to intubate this resident. I don't think he's breathing. For this next section, I asked my audience of labor and delivery nurses, what is the most unhinged thing a new mom has said to you in the labor and delivery room? These are the top comments. I can't wait to smoke a joint after this. Yes, I'm sure the nurses also said the same thing. If I ever say I want to do this again, shoot me with a paintball gun to the tits. I hope one day she tells her kids this lovely story of how they were born. Did someone pour hot lava on my vagina? Please save my lady garden. You can C-section me if you think the garden is in peril. Lady garden is just making me picture a full bush. Full bush. Full bush. Do I want to use a mirror? If I wanted to watch my ass blow apart, I'd eat 12 gordita crunches and twerk on the sink of a Walmart bathroom. Not the worst thing a Walmart bathroom has ever seen. I had a gentleman and lady come in, clearly country folk, cowboy boots, big belt buckles, she's in some Daisy Dukes. Ran her husband through with a strap on, and the man had a perfed colon and had to go in for 2 surgeries and was in the ICU. If you don't know what a perfed colon is, it's when your colon gets penetrated and has a hole in it now. So the strap-on went right through the colon. Boy, was she proud. A little remorseful, but no shame about the number she did on her husband. Jesus Christ. She poked a hole in his colon as she was doing him from behind. Well, we don't know. Maybe it wasn't from behind. Maybe they like it face to face. I wonder what the safe word was. Howdy? Good thing is, he was definitely walking like a cowboy for 2 weeks.
Reach for the sky.
Tips from the ER. Stabbings. If you've just been stabbed with a sharp object, the first thing you're gonna wanna do, the very first thing, is to leave it the fuck alone. I don't care where it is. Head, chest, belly, balls, boobs. You're gonna fight against every sexual instinct you've ever had, and don't pull out. I know these big Hollywood movie stars would love to have you believe that you should pull out that knife from your thigh, wrap it up, and keep walking. That's not gonna work, okay? If you pull out the sharp object, what's gonna happen is that you are going to bleed out and die a slow and very painful death. Remember, just don't touch it, because if it hurt like a bitch going in, it's gonna hurt like a bitch coming out. Try to keep it still, call 911, or get your ass to the ER without moving it around too much. It should be obvious why you shouldn't move it around, because it's gonna hurt like a motherfucker, and you're gonna do more damage to your body than it already did. That object is now the official body plug keeping you alive. So, Remember, ladies and gentlemen, whatever you do, never pull out.
Come on, honey, just one more push. My baby girl is almost here. You mean my baby girl? I said what I said, and it's about the last thing you're ever gonna say. Hey, no fighting in my delivery room. Honey, you're doing so well. Unlike this Neanderthal, I would never teach my baby violence. Well, unlike this weakling, I'm gonna teach my baby how to defend herself. My baby won't have to defend herself because I'm gonna defend her with my life. I brought my baby a Build-A-Bear. I brought my baby a bigger bear. I brought my baby a real bear. Woo! Here she comes, one more push. Congratulations!
Ooh, don't be mad.
Healthy baby girl, born 7 pounds, 6 ounces, vital signs within normal limits. Baby's father was not present for the birth. Mother and 2 male companions present. Mother and 2 male ex-companions present.
When I worked at a small town hospital, there was only one RN per shift. About 2 a.m., a guy called about his wife. He said she had an episode, so he brought her in. The young couple was married for about 3 months. I asked her to describe her symptoms. She felt like she was going to faint. Her husband said she was shaking, and her eyes rolled back in her head. She felt hot. I took her vitals, and they were good. Then I asked the most important question. What were you doing when it happened? They both blushed and finally said, making love. I had to control my laughter and then explain very gently to them what an orgasm was and that it was normal. They thanked me and headed home. No doctor needed. A good story that broke up a quiet night. I love these small town hospitals, man. This is hilarious. They didn't know it was an orgasm. An episode? I don't know if I've ever given a girl an episode. I've definitely given a girl a commercial break. Ladies, if you want your man to love you forever, take him to the hospital and have a doctor explain to them exactly what an orgasm is, so they know what to look for. Good luck. True love story. Tips from the ER. Digital disimpaction. Pretend this is your colon. That's your anus. This is where the stuck poop is. If the doctor opens up your gown and sees there's poop right here, and he sees that he could stick his finger in there and scoop out some of that poop to help you poo, this is what he's gonna do. He's probably gonna have gloves on. He's gonna take his finger and he's gonna try to scoop out some of that poo as little and as gently as he can so as not to rip your little anus. And as soon as he gets enough out, oh, it's free! That's what happens at a digital disimpaction. Sometimes. And also, funny thing, sometimes when we stimulate your anus, it also causes you to poop. Odds are, if you come into the ER for constipation, there are things we can do to help loosen up your poop so we don't have to do a digital disimpaction or surgery. But the moral of the story is, drink your water, eat your vegetables, and stay the fuck out of the ER. If you hear your name, please follow me. Rice. Is there a Rice here?
It's Ricky.
Rick? E?
Yeah, the E's capitalized. I don't know if you can see it.
Yeah, no, I see it now.
Is there a Millie? Mlee?
I think you're trying to say Emily.
How is this Emily?
M-L-E. Duh. Can't you spell?
Guess not. Okay, lastly, is there a ADC? A DC?
Oh, yep, that's me. It's Odyssey, bro. Odyssey.
Of course it is. All right, everybody, follow me. If you hear your name, please follow me. Is there a Kavilin? Kavilin?
Oh, actually, it's Caitlin.
How is this Caitlin?
It's spelled with Roman numerals. It's unique.
Right. Okay. Is there a Ison? Tyson?
It's Addison.
Addison. I see. My mistake.
You're forgiven.
Lastly, do we have a Tur here. Tur? That's probably me. You're Tur? It's Lester. Of course it is.
I'm an OB/GYN. When I first started training, I was learning to do cervical exams to check patients in labor. I am examining this patient and I feel something that even I know isn't quite right. It feels hard and kind of crinkly. I take this thing out. It is black, desiccated, and just coated in copious amounts of discharge. I'm turning it over, trying to figure out what I'm looking at. I eventually see a yellow smiley face. It's the remains of a Walmart plastic bag. I am surprised the face was still smiling. I tell the lady, "Ma'am, you had a plastic bag in your vagina." She goes, "How did that get in there?" I say, "You tell me." She swore she didn't know. All of us on L&D decided this was likely the condom that was used to prevent the pregnancy that she was currently delivering. Anyway, the moral of the story is, don't use plastic bags as contraception. Please. Most people just keep their Walmart bags under the sink. You do you, boo. What city was this story come from? My guess, Arkansas or Alabama.
Alabama?
It's from Alabama! Imagine what the dirty talk in bed sounded like. Do you like paper or plastic?
Hello, how can I help you? I need you to test this. What is that? It's my boyfriend's pubes on a towel. Ew! Oh my god! I almost touched that with my mouth! I need a paternity test to see if he's the father. We don't do that here. This is an ER. Well then, can't you send it somewhere? This is a hospital. No. I need to know if he's the father. Why wouldn't your boyfriend be the father? Because I'm sleeping with another man and I don't know who got me pregnant. Ma'am, like I said, this is an ER. We don't do... Are you really going to deny a pregnant woman? No. Of course not. Let me just put this glove on and I'll take that from you. Hey, Austin, catch! What is this? Some dude's pubes on a towel. Oh, gross! Rich! Okay, all done. Test determined, he is the father. But how? You didn't even get my DNA, or the baby's. Oh. Right. If you aren't gonna test it, I want that hair back and I'll go to the hospital down the street. Well, I am not leaving until I get that hair back. Of course. Let me just put some gloves on. I'll be right back. Austin, where'd you put that towel? I burned it, Rich. Go away. Ugh. Fine. Okay. Ah! Oh. Okay. Here you go, ma'am. I found it. Finally, useless. I'll find out who the father is myself. Good luck with that. Next.
A friend of mine who's been a long-time nurse in a hospice shared a heart-touching story with me. She was caring for an elderly lady in her final days. The woman was often visited by her loving family, including her devoted husband and their 3 grown children. I can already guess what this is going to be about. The children aren't his.
Wait, there's more.
One night, when the family had left and the ward was quiet, the woman confided something quite unexpected in my friend. She revealed that before marrying her husband, she had a brief but passionate love affair with a young artist in Paris. I knew it. Her kids are French.
French.
She always considered it her life's greatest romance, but had to end it due to family pressures. She never saw him again after leaving Paris. The confession was not of infidelity or hidden offspring, but of a lost love that she carried in her heart all her life. Aww. The next day, my friend noticed an old, faded painting in the woman's room. It turned out to be a portrait of her, done by that very artist during her youth in Paris. This revelation added a layer of depth to her story, making it all the more poignant. Oh, okay. Bitches are loyal. That's so interesting. She carried it everywhere she went. Makes you wonder how often women think about the ones that got away. Is that what you guys are doing? Just thinking about your passionate love affair in Paris while you're married to your husbands? Is that what you guys are doing?
It's been 84 years.
I'm just kidding. Ladies, I love you all. When I was one day postpartum with my little boy in the hospital, I was telling my nurse about the birth. When I was done, she must have noticed me gripping the armrest of the sofa chair I was sitting on. She asked, "It seems painful to sit on your stitches. Would you like a donut?" There was a brief pause. I looked at her funny and replied, "Sure, what flavor?" "No, my dear, we are not talking about donuts that you eat." She started hysterically laughing and explained to me that she was offering me this little inflatable donut-shaped thing that I sit on so my vagina doesn't touch the surfaces I sit on. My husband and I had a good laugh about it after. Yes, correct. Ladies and gentlemen, if you come to the hospital and, you have birth, you have surgery with anything regarding your undercarriage, we do have an inflatable donut for you to sit on that looks like this. Ta-da! These are a lot more comfortable. The ones you're gonna get at the hospital, I'm telling you, they're gonna feel more like an inflatable floaty for the swimming pool, which is fine, but this is very comfortable. As you can see, there's a hole here, so when you sit down, your torn up vagina from that baby doesn't have to touch the surface of the chair. Very comfortable, very unedible. Is that the right word? You can't eat it.
Forbidden donut.
All right, Anthony, I'm gonna start an IV on you. Why? Because the doctor ordered you some medication and I need to start an IV to give it to you. Okay, but please tell me everything you're gonna do before you do it. Of course. First thing I'm gonna do is tie this tourniquet around your arm to get a better look at your veins. Ow, that's really tight! It'll just be for a second. It's too tight, you need to loosen it! Okay, how's that? That's better. Okay, this is gonna be a little cold. I'm gonna clean the area. What's in that? It's just a little soap and disinfectant to clean the area before I put the IV in. Okay, fine. Here we go. Ah! Okay, here comes the needle. Big poke on 3. 1, 2, 3. Ah! Okay, all done. Is that it? Yep, just gotta flush it with a little saline and we can start your meds. Whoa. What's in that? Just some saline, a little salt and water. No, I can't have that. I'm not allowed to have salt. Oh, there's very little salt in here. It shouldn't affect you at all. No, my doctor says I can't have salt because my heart is weak. Plus, it makes my stomach hurt. I'm on a no salt diet. It should be in my chart. Please read it. Anthony, this amount of salt should not affect your heart. If you push that into my veins, it will give me a heart attack. Are you trying to kill me, you dumb mother...
52-year-old male with chief complaint of 8 out of 10 chest pain that radiates to his abdomen. Upon attempt to place patient IV, patient states that he does not want IV to be flushed with normal saline because it contains salt, which will make his abdominal pain worse and give him a heart attack. Attempted to explain to patient that there is minimal salt in saline, to which patient replies, quote, "Are you trying to kill me, you dumb motherfucker?" End quote. MD notified. Ordered a flush with dextrose instead. Patient agrees. No further incident at this time. The psych team will come down. They will talk to you. And if they think that you need extra psychiatric help, they will put you on a 72-hour hold and they will transfer you to a psych facility. So the 8-hour medical hold can be shortened. Again, if they come down and deem that they're just having a bad day, a bad hour, they're okay now, you will be able to go home with resources and information for you to follow up. If they believe that it is more important for you to stay and get further help, they will put you on a 72-hour hold and then they will start working on placement. Where can you go to get the right help? Usually a psych facility, or if you're lucky, your hospital will have a psych unit upstairs and you will get transferred upstairs. I would love to warn all of you, if you come to the ER for psych issues, there is a good chance you're going to be waiting in the ER until a bed opens up. Fair warning, okay? Again, that is because there's been a huge increase in psych patients and our psychiatric providers and resources have not caught up yet. They're getting there, which is why you are now going to be stuck in the ER for a little bit as we try to sort things out and figure out where to put you. But remember, it's always better that you actually went to the ER and got help rather than sitting at home alone with these thoughts by yourself. It sucks in the ER, but at least you're doing something to help yourself. So don't kill yourself. If you think about it, just turn it off.
I'm kidding.
So again, don't shoot the messenger. We are just doing our best. We were not meant for psych patients. There should be psych facilities for you to go to. I believe in that. Don't come to us. No, don't come to us. I was working in the birthing center. The patient was in the jacuzzi in labor. The husband joined her in his underwear. I gave him a fishnet to scoop the poop turds out of the water while his wife was pushing. I forgot. Women, when you go into labor, there will also be poop. He was so turned on by the whole thing that he had a hard-on. Wow. The craziest thing, that wasn't the craziest thing. The craziest thing was that the patient's parents were in the room witnessing the whole thing. I wanted to throw up. A lot to unpack here. I don't know what the husband's turned on by. The floating poop, the baby coming out, the warm water in the jacuzzi, or the parents watching. Maybe it was everything. Maybe this is his actual wet dream coming to life. Wet, literally, in the jacuzzi. If you don't know what a birthing center is, it is a place you can go to have your baby. It is very different from a hospital setting, and that is why people prefer it. It is more calm, it's usually more quiet, it usually feels more like a home birth. You have midwives, you have nurses, sometimes you have doctors, and most importantly, you have a jacuzzi, so you can have a watcher birth. Some people believe that it is better and safer, more natural for the baby to be birthed into water. Their choice, their preference, I have no idea. The one problem that I've seen with these birthing centers, in case of an emergency, you will have to be transferred from the birthing center to a hospital, which they will do for you, and they are ready to, I hope. The other problem is, if you have your birth at a birthing center, there is a chance you will shit in the jacuzzi and your husband will get a hard-on, which I don't prefer, but hey, if that's in your birthing plan, get it, girl.
Enjoy the miracle of life.
When I was in school, I was shadowing an ICU nurse and we were taking care of an elderly woman dying of brain cancer. One day, when her family went home for the night and we were getting her ready for bed, she randomly blurts out, "Should I tell him they're not his?" Woo! Starting off strong. She was referring to her children and husband who had just left. She elaborated and told us that their 2 children are both another man's kids. Not just any man's, but her husband's childhood best friend. What made this even crazier was that her children were probably 50 years old. I have no idea how this stayed a secret for so long. Is she gonna tell them? Fast forward to the next morning and I see an unfamiliar older gentleman in her room. Is it him? Before I said anything to anyone, the other nurse whispered to me that he is the husband's childhood best friend. Son of a bitch, there he is. I don't know whether or not they were still messing around, but I don't think I've ever seen a secret 50-year-old love triangle. How is this possible? Also, does the best friend know that he has 2 kids? Does he not see that maybe they look like him? What? Her kids are 50. She's got to be close to 70. How does she live for that long with a secret like that?
My heart is getting stronger every day.
If I had a secret like that, I would feel so guilty. I would be dead by 40. There's no way. Stress is a big factor in causing health problems, if you didn't already know that.
You're stressed. You're stressed.
This is pretty wild, okay? When patients know they don't have enough time left, they will confess some of their deepest, darkest secrets. But in this case, I think it might be best for her just to take this to her grave. I don't think anyone needs to know this. It's too late. Even if you said something, would they believe you? This is crazy. It's always the ones that tell you not to worry about, gentlemen. These hoes ain't loyal. Play Chris Brown. If you've ever heard of a crazy or shocking deathbed confession by a patient, comment below. Let's hear it. I am currently on tour. Ticket links and dates are in my bio. I hope to see you there, motherfuckers. Bye.
Welcome to the ER, ma'am. How can I help you? I'm having some pain in my chest. Okay, just lay back. We're gonna do a quick EKG. What's an EKG? It's just gonna take a picture of the electrical activity of your heart. Make sure you're not having a heart attack. You're gonna do it right here? Yep, just some stickers around your chest, arms, legs. I'm gonna hook you up to this machine right here. Oh. Okay. Are you wearing a bra? No. That's okay. Pardon my reach. I'm just gonna lift. Ow! What was that? Oh. Did you mean to put this there? No. Oh, well, here's $7 and your EKG looks good. Oh, good. Thank you. You're welcome.
Psych patient who was being watched by police managed to climb up an X-ray machine that was mounted on the ceiling and ended up in the ceiling crawling around. We had to move a family who was in the room next door as their relative had died. The ceiling crazy man ended up falling through the ceiling tiles and would have ended up landing on the dead body. Talk about lucky. He could have ended up anywhere, but right next door and fell down. I've never had a patient crawl into the ceiling. People tell me it's happened. Good news for the patients who could possibly have been injured by a man falling through the ceiling is that they are already in the hospital, so they can get treatment right away. I am always looking on the bright side for you guys. We had an inmate get stabbed in the cheek with a pencil. Cheek. I was helping the doctor remove the pencil and suture his cheek. The inmate was worried that it would leave a scar. So I told him that we would use leftover foreskin from the local hospital as a graft. That way, the stem cells would help with the healing process and leave absolutely no visible scars. Yes, leftover foreskin can be used as a skin graft. I did not know that either. Which makes sense with all these circumcisions happening. It's a brand new skin. It's young, it still hasn't had time to grow yet. It's kind of the perfect situation. He was happy to hear that he was getting fresh foreskin on his cheek until I said, "You'll just be a little cockeyed." Dropped the mic and left the room. He did not find it funny. I wouldn't find it funny either. I'd be more worried about my cheek getting stiff for no reason. Leftover foreskin from a local hospital. That's more suspicious than sushi at Arby's. In the psych unit, we had a very creative escape artist, just like the movie Shawshank Redemption. This man was chipping away at the brink wall under the windowsill in between safety checks. He made a good dent in the brinks in an 8-hour shift. Holy how? Wait, I have a question. What was the psych patient using to chip away at the wall? His teeth? What happens after 8 hours in a psych ward? Does he come out for PE and we check the walls? Good for him for trying though, huh? Maybe he had a poster? Maybe it was behind a bedroom? behind the bed? There's no way. Because when you're in a psych ward, I've seen a psych ward. If you've seen a psych ward, well, it depends on which room you are. The crazy rooms, the bed is right in the middle. And then there's just walls. And there's like restraints on the bed. If he's smart enough to try to chip away at the wall, he's probably smart enough to fool everybody that he's sane, you know? Pediatric ER with the chief concern of monkey bites. A lot of animals in these stories. The ER tech poked his head out of triage to let the nurse know the monkey was with the patient in the room. The monkey then proceeded to bite the mother. Security was called, and of course the policy was looked up. What policy? Ain't no fucking policy. Get that monkey out of there. Eventually, we told parent that monkey could not stay. Mom opted to take patient and leave before being seen by provider in order to stay with the monkey. Was this a pet monkey? It's mom's monkey. Mom's monkey who's clearly not trained. Sure, take the monkey side. I've had it with you parents, alright? I've stuck up for you guys so many times because I know kids are stupid, but parents, we need to do better, okay? Fuck the monkey. Don't fuck the monkey. I'm saying, put your kid above the monkey. Not my story, but one from my attending. Attending is the head doctor. A code was en route and the female patient apparently had chest pain while having sexy time with her female partner. Ooh. 2 ladies. She was driving herself to the hospital and crashed. He said they never took the strap-on off, and during CPR, the thing just kept bouncing around. Finally, one of the compressors and the team lead asked if someone could please take it off. Unfortunately, she died, but that's a code he will never forget. I've never had to deal with a strap-on, but how hard is it to take that thing off before you start taking care of the patient? R.I.P. R.I.P. It could be why she crashed. It's never easy driving stick. At least they took it off before the funeral, right? Let me be honest here. If I showed up to an emergency and the patient still had a strap on, I guess if they're unconscious, it wouldn't be the first thing I think about dealing with. First of all, you gotta check if the patient has a pulse. And if they're breathing. Yeah, I would start CPR. I guess I would leave the strap-on on. Because it's not hurting the patient. It's not like they've been in the sun for 3 hours, then you gotta take them out of the sun before you start CPR. Or, if they're in like a cold environment, if they're like wet, or they're really cold, they've been outside for a while, then you gotta take them inside and then start CPR. But a dildo? It's not hurting anyone. Not yet.
Wink!
Not a nurse, but a mom. My 3-year-old son's testicles tried to kill him. It was a hydrocele that was woken up by the rhinovirus that dropped his potassium to critical levels. Dude's balls were the size of a baseball. He's fine. It's just funny his balls almost killed him. LOL. Your son is 3 years old. You're laughing at an enlarged testicle. Imagine how big that is in comparison to a 3-year-old. I've seen enlarged testicles on grown-ass men, and I'm telling you, they are the size of volleyballs. I had a guy whose testicles were so big that it somehow folded over and we lost his penis. We were trying to put a Foley catheter in him so he could pee because he couldn't get up. And we were like, where the fuck is the penis?
Touch my pee-pee. Your pee-pee! Where is your pee-pee? Show me the pee-pee!
But a hydrocele, technically, painless swelling in the testicles. It's filled with fluid, and we will do everything we can to bring it back to its normal size.
How you doing in here, Jenny? I still feel nauseous. Well, it makes sense. We got your test back. You're pregnant. What? I can't be pregnant! Why not? Because I just graduated! No, I'm the first in my family to graduate high school! I have to go to college! You can still go to college. There's a lot of options you have with the pregnancy. How can I be pregnant? I don't understand. Are you sexually active and using birth control like condoms? My boyfriend doesn't like using condoms. We've been using spermicidal foam. Spermicide isn't always 100% effective. It's actually one of the least effective ways to protect yourself during sex, especially when used by itself. You should always use it with a condom. Well, for as bad as it tastes, it should work better. You're not supposed to put it in your mouth. Where do you put it then? It goes in the vagina, 10 to 15 minutes before having sex. How was I supposed to know that? There's usually instructions on the box. Are you sure you're ready for college?
Oh, hell no, man. What the fuck, man? Get your ass on, boy.
EMT RN here, and a woman called 911 for genital burning. Genital burning. Could be anything. UTI. I figured it was probably an STD or UTI. After questioning her and getting a history, it turns out she was using anti-baby wipes to prevent pregnancy after sex with her boyfriend. The wipes in question were the purple top bleach wipes that had a picture of a baby on the side in the circle that was crossed out. Oh my god, she thought that meant the wipes prevented pregnancy. They shouldn't be used on children because they're bleached. Yeah, no shit. Per the hospital, she had second-degree chemical burns in her labia and a positive pregnancy screening. Ooh! Now that's a double whammy. If you don't know what these wipes are, they are literally bleach wipes with a little baby on it that is crossed out. So, mom saw this and thought, hey, that means these wipes get rid of babies.
It's genius, it really is.
They do not. They're specifically meant not to be around babies because these are very strong. This is what we used when COVID first started, and we were like, what the is COVID? How do we get rid of it? These killed those things. This is not for your labia. This is not to get rid of babies. Actually, I'm sorry, this will get rid of a baby. Hence, the cancel baby sign. Help! But it is not a way to prevent pregnancy. Don't do it.
I don't know if I can even tell this one with a straight face, but I was taking care of a patient and I had a med student. The patient came in with a rectal prolapse. Rectal prolapse is when your rectum turns inside out, sticks outside of the body. So the med student tried to push it back in. He couldn't get it back in, and he asked me, what else can we do? And I told him, well, you need to find some sugar because we put sugar on a rectal prolapse, and when you do that, it draws out the fluid and you can push it back in. And so this is the middle of the night, and he tells me, well, the cafeteria's closed. I don't know if I can find any sugar. I tell him, well, just go see what you can round up. So I go back to the room, and I'm trying to put the rectal prolapse back in the room. And guess what he walks back in the room with? I am not kidding. The Snickers bar. Imagine the look on the patient's face when we pull out a Snickers and we tell him we're going to fix his rectal prolapse with this. I mean, Snickers always satisfies, but I don't think that's what they meant.
All right, I learned something new. Put sugar on a rectal prolapse to suck up the moisture and push it back in. Kind of like salt on a snail, I guess. What you can't do is rub a Snickers bar on a rectal prolapse, hoping it'll go away. Good on the med student for trying. You ask for sugar, you're getting sugar. I was working in labor and delivery and was wheeling a laboring mom from the emergency department into a labor room when she started screaming, "Epidural, epidural, now!" Oof. Husband and 2-year-old gave me a wave when we got in the room and said, "I'm gonna go park the car, I'm out." You son of a He left! As soon as he left, she started screaming bloody murder, and when I took a quick peek down below, I saw a head.
Surprise, motherfucker.
Oh no. I said, it's way too late for an epidural. Baby is coming now. There is a point during birth where the epidural cannot be given anymore. Seeing a baby's crowning head is a very clear indicator that you are no longer getting an epidural. The patient went berserk and started hitting me. Oh! Then latched onto my arm and hung there limp and screaming. Oh my god, what about the baby? I had to drag her sorry ass across the labor room to the emergency button, which was in between the headboard and the fetal monitor tower, while this lady hung off me like a baby possum. Oh my god. Another nurse came and she leapt up and punched the nurse in the nose. This lady is crazy. The next nurse came and she kicked her in the stomach. Then the three of us grabbed that lady and tossed her ass in the bed and delivered her baby safely despite her best efforts. Father walked in after everything had settled down like he knew he missed a show. Yeah, he did. Can you imagine the car ride over to the hospital? This dad was probably, he could not wait to tag in the healthcare workers. And what an for not telling them or warning them what she was capable of. It was 3-1 and she looked like she was gonna win. Well, 3-2. Baby was coming. That baby literally came out to the John Cena theme song. The mom beat up the healthcare worker so bad they needed the epidural. Can you imagine? Epidural now for everyone.
When my daughter was 4, she stuck a popcorn kernel in her ear. Yes, children love to stick little things in their little face holes. I've had little plastic balls, I've had lots of Legos. Popcorn kernel is new. No way was that thing coming out. Her dad was not at all impressed and let her know it. We arrived at the hospital and my daughter marched right up to the admitting desk and said indignantly, "My daddy yelled at me." Aw, she still got her wits about her. That's good. As it happened, though, they tried several tactics. Irrigation, rolling it out, attaching something sticky and pooling. They couldn't extract the kernel at that small northern hospital. Ah, okay. I was like, what kind of hospital tries to stick something sticky and then pull out something that's in a child's ear? What you should have is a cat's extractor, and this is what we used at the hospitals I worked at. A cat's extractor is a syringe with a little straw at the end that has a balloon at the end of that straw, where if you push the syringe, air will pop that balloon up, and then you could extract anything out of a child's nose, ears. Those are the two biggest places. I've seen it used. It's amazing. Whoever Katz is making so much money. So this is what they should have used, not a stick and pulley thing. The popcorn kernel was too well in her ear, so my husband had to drive the girl several hours south to a bigger hospital where they had a special claw tool specifically designed for this purpose. That doesn't sound like a cat's extractor, but sure, special claw tool. The best part, as my husband tells it, was the fact that he spent most of the drive reassuring the kid that there would be no needles, as he couldn't see any reason they'd need one. Then they arrive and discover that in fact the child would have to be sedated for the procedure. Sedated for the procedure? I mean, if the popcorn kernel was like really far into her ear, maybe I could see them having to sedate the child, but in my experience, all we had to do was hold the kid down. Even if they were fighting, enough of us to hold a 4-year-old down doesn't take that much, right? One tech hold the knees and the body, the other tech to hold the head down. Doctor just comes in with the cat's extractor, pops that thing right out. Don't need sedation. I don't know what hospital this is. The little girl was all needle, and her dad was oh, the dad laughed at the daughter. You know, I'll bet the daughter did not need sedation or a needle. I'll bet the dad went up to the doctor and was like, "Hey man, I need to teach my little girl a lesson. Can you give her a needle?" That was the last time she ever shoved anything in her ear. Ah, it worked.
Here's a story of a messy mom from when I worked in labor and delivery. 2 men in the room on each side of the pregnant patient. Everyone is white. The patient did not know who the father was. Both men were competing in the I can be the most supportive contest. Well, the baby was born, not a white baby. Safe to say the real father was not in the room and the two men were confused. You're confused? You should just leave. Not a white baby is literally everything else. Can we guess what color the baby was? Comment below. Yeah, I'll bet everyone in the room was confused, including the baby.
I'm confused, bro.
Welcome to the ER, ma'am. How can I help you? Help me, please. My vagina's burning. Have you ever had a UTI before? I have, and it does not feel like this. Could be an STD. Are you sexually active? Yes. Using protection? Just anti-baby wipes. Anti-baby wipes? Yes, the same ones you have here. Here where? There. These? Yes. These are bleach wipes. Why would you think they prevent pregnancies? There's a picture of a baby on the side that's crossed out. That means they shouldn't be used on babies! Oh. Well, looks like you have second-degree chemical burns on your labia. Oh, no. Also, your labs came back. You're pregnant. No. Yeah. These are condoms. Have you seen one of these before? Hey, Mr. McDonald. Hope you're still doing okay. I have a new nurse here. This is Rena. Is it okay if she takes over your evaluation? Of course! How's it going, Rena? Hi. So, Mr. McDonald, as you know, you've been exposed to a potentially rabid cow. That's right. And you'll need the rabies vaccine to prevent infection. That's what they tell me. It'll be a series of injections depending on weight. Not a problem. 350 pounds. Oh no, I need your weight, not the cow's. 350 is my weight. Oh. Okay, thanks. We'll be right back.
Hi, I'm taking care of this patient and he stopped breathing. Who are you on the phone with? 911. Hit the blue button! The ER can be a bit overwhelming for new nurses. What are you doing? ChatGPT says compressions need to be at least 2 inches to effectively squeeze the heart and circulate blood throughout the body. Go get the crash cart! It just takes time to adapt to the speed of the ER. What is that? You said get the trash cart. I said crash cart. Why would I need a trash cart? I don't know. For the body? It's not for everybody. He's in VFib. Get ready to shock. Charging. Okay, let me know what... Ah! My bad. We did manage to get the patient back. Says here code status dinner. Luckily we got him back in time for dinner. DNR.
I took a patient to surgery and removed all his teeth. 1 week post-op appointment, he whispers to me a question. He wants to know when he could go down on his girlfriend. I appreciate the dedication to love, but I had to remind him he had 32 open wounds in his mouth. Maybe give it a few weeks or we'll see you again. Good job, man. Nothing will stop him from eating out his wife. I think. Is it? Did we say wife? Girlfriend. Eating out his girlfriend. Imagine what he could do for his wife if this was just his girlfriend. Whispering with no teeth sounds hard. Hey, babe, when can I eat the Irony is not being able to go down on your girl because you're bleeding.
This is how I delivered my second born, on all fours. I felt confident in this position and my body knew exactly what to do. I trained throughout my entire pregnancy and
your body knew exactly what to do. That's the position that got you in that position in the first place.
different variations of this position because I wanted to train myself for motherhood, and that includes training for labor. My body was trained to work and be strong on all fours due to all the work I've been doing the previous 38 weeks. 5 pushes later, and baby Wyatt popped right out.
Wow, look at that. She trained in the doggy style position to give the baby. I didn't know you could do that. What's the husband doing? Why is he pushing up on her? Are there other positions you can give birth on? Let's see. Rocking, squatting with partner. So partner is involved. Good job, partner. Squatting again, leaning forward, kneeling with birthing ball, on hands and knees. There it is. Semi-sitting with partner. Oh, that one seems intimate. Lying on your side. All right, we learned something new. Comment below, which one is your favorite when you were giving birth? I'd love to know. Once I had to give a baby boy a glycerin suppository so he could have a BM as he was constipated. BM means bowel movement. This kid came in because he was constipated. A glycerin suppository is a medication you stick in the rectum to help you poo. I explained to Dad what I was doing, and he proceeds to ask me if that was going to make his baby gay.
I cry because others are stupid and it makes me sad.
You'd be surprised how often this happens. Hey, if you put that thing anywhere near my son's butthole, will that make him gay? You know, sometimes we have to put a rectal thermometer in the baby to check for a fever. And I so badly sometimes just want to be like, well, you know, there's a 1 in 3 chance. Parents, if your child ends up being gay, it is not because the hospital had to stick a glycerin suppository up their butt. Your child will be born gay. Yeah, and you hit the lottery with that one, because gay kids are awesome. When we had a patient expire and we were so busy, nobody knew she passed. Well, anyway, her daughter comes to visit and finds mom dead in bed with oxygen still going on. Daughter comes out of the room and asks me, do you always leave them for the family to find? Whoops. No, we don't normally leave them for the families to find. We usually notice it first. What probably should have happened is the patient should be on a monitor hooked up to a central monitor at the main nurse's station. So we normally can see everybody's vital signs, heart rates, respirations, and blood pressures at the nurse's station. But it sounds like they were so busy that they may have missed it. You know how to fix this? Staff your hospitals. What a novel idea.
That sounds expensive.
A woman came in after being thrown off her boyfriend's motorcycle while they were evading the police. She got thrown into an iron rod fence upside down. She was stuck upside down until fire could show up and get her down. What? When PD talked to her in the trauma room asking who the boyfriend was and where he would have gone, she said nothing. I've never known such loyalty. Let's be honest. If the person you love is the person who throws you off their motorcycle, you definitely don't want to say anything. You also might want to leave as quick as possible. You know what the silver lining about this story is? She was probably wearing a helmet. You can't get thrown off a motorcycle, land upside down, and survive. That's the one thing we see in the ER all the time. Motorcycle accidents, generally, never good. Also, always wear a helmet, even when you're biking. I don't care if you look like an idiot. Put the helmet on. PSA from ER worker, 10 years. Do it, or you die. When I was a student nurse on my maternity rotation, we once had to ask a dad and his mom, the grandmother, to leave when we went into the room to check on the new mom and found her sitting on the radiator. Oh my goodness, why was mommy sitting on the radiator? Dad was asleep on the bed,
What?
And his mom was hanging out in the guest chair. His mom said he worked the night shift. She didn't have an excuse for herself. Okay, ladies and gentlemen, we're gonna repeat this again and again until it is lodged into your teeny tiny little brains. If the mother is giving birth at the hospital, the husband who's there is not allowed to sleep. If the mother who just gave birth isn't sleeping, he's especially not allowed to be sleeping on the hospital bed that the birthing mother should be sleeping on. And bonus, if your husband's mother is also in the room, she's not allowed to be sitting on the only chair that's left that's supposed to be reserved for the birthing mother. I don't give a if you worked the night shift. You could have worked 6 night shifts in a row. Get your ass off the bed.
What's going on today, sir? My dad had knee surgery last week, and now he can't stop peeing. Not to worry, we'll get him checked out. Any pain in his knee? No. Anything else besides the frequent peeing? No. We will need a urine sample from him. I knew you'd say that, so I brought it. Brought what? His urine. Here. It's still warm. Oh. Wow. Okay, give me a second. Do you think it could be a UTI? We'll know more once we get this to the lab. I'll be back. Ugh. Okay, sir, What are you doing? Oh. Is it okay if I use this? 76-year-old male brought in by son for frequent urination and past medical history of left knee surgery. Upon initial assessment, patient's son provides a urine sample in a container that he collected from home. After urine was sent to the lab, patient's son was seen washing the container using the sink in patient's room. advised patient's son against reusing containers with urine in it, to which son replies, quote, "Why would I throw away a perfectly good container?" End quote. MD notified. Social work consult requested. No further incident at this time.
I work in a prison, and years back, we responded to an unresponsive inmate inside of a bathroom stall. The guy was so obese, we had to tear the bathroom stall off the wall to pull him out and lay him down. It's a big boy. The guy was turning blue, no pulse, pants around his ankles, and fully erect. I don't know if I've ever had an erection while going number 2, but who knows? Why did he have an erection, you ask? Well, my colleague started the first chest compression, and there was a solid fart as a homemade plastic butt plug shot out of his hole and clattered across the tile floor. The guy had a heart attack, gratifying himself in the john. You can say he shanked himself. I guess when you're in prison, how else are you gonna get a butt plug? It's gotta be homemade, unless someone sent it to you. Is that something you guys screen for in the prisons, if they get a butt plug in the mail? I know you guys screen for stuff, but will you say no to the butt plug? Or is that something you let slide every once in a while? Clearly not, because he had to make one. What do you think it could have been made out of? Comment below.
They take the dinglebop and they push it through the grumbo.
Ambulance is here! What do you got? Ooh, what happened to that guy? NBA versus pole. Guy took his wife's Porsche to go visit his mistress, crashed it on the way home. Talk about karma. Yeah, wait till the wife finds out. There you are, you son of a bitch! Uh-oh. You're cheating on me and you crashed my car? Honey, please, not now. I'm in pain. How long has this been going on? Hey, guys, can we keep it down? There's other patients here. You lied to me, Brian! Oh, we sure did. The pain's too much. I don't even remember what happened. You don't remember? You don't remember? I'll help you remember. Yeah! Take that back to your girlfriend, you little
48-year-old male MBA versus Pole with chief complaint of fractured left femur and multiple hematomas. Upon returning from CT, patient's wife arrived and violently rips out patient's Foley tube as if she was trying to start a lawnmower. MD notified. Police report submitted. Surgery consult for reconstructive surgery in progress. Success seems unlikely. We'll continue to monitor.
Once you get back into the ER, we will get you changed out of all of your clothes. This includes the bras for the women, but you get to keep your underwear. We'll bring you to a bathroom. Probably not gonna let you go unsupervised in the bathroom, but somebody will help you change out of your clothes into a hospital gown and hospital socks. Ta-da! They will not always be bright yellow. These are great. There's grips, so you don't trip and fall on the slippery hospital floors. Once you change out of all of your clothes, we will also now be documenting all of your belongings. In the hospitals, we use clear plastic bags, so we know what you have at a glance. Kind of like going to a rave. You come in with plastic bags, so security knows if you have anything that can harm people. This bag includes all of your belongings, all in here, all very well documented. Now, the last few places I've worked, we will take your phone away because you're not allowed to have it, but if you want to use your phone, you can ask somebody there, say, hey, I want to make a phone call. They'll get your phone for you and they'll let you use it supervised. All your stuff will then be put into a locker or somewhere in the ER for safekeeping. Tips from the ER, 72-hour involuntary hold. In California, we call that a 5150, and that is an official psychiatric hold that says you are not allowed to go anywhere for the next 72 hours, and this hold is put in place if you are a danger to yourself or others, not just SI thoughts. If you're having HI thoughts. Here's Johnny! A 72-hour hold can be put on you by police officers, psych doctors, or the ER team. Any one of these guys can put you on a 5150 hold. During that time, you will get psychiatric help, and we will be evaluating you all throughout the day to make sure that you don't yourself. I don't know how else to say it. If you are safe to go home, they will send you home with follow-up resources. If they think it is better for you to stay, you will now be put on a 14-day hold. In California, that is called a 5250, and you will stay for a little longer to make sure you are safe. Ain't that right? Yes, I hope you don't yourself. There's a trick, actually. I don't know if we should put this in there, but if you come in with thoughts of hurting yourself and you have a plan, we take that much more seriously, and you will definitely never leave. Overdose patient comes in with an unknown time down after freebasing a fentanyl patch. Ooh. Unfortunately, the patient was without oxygen for too long, so we started talking about withdrawal of care. This particular doctor liked to have the whole team involved in the discussion, including the primary, RT, RN, etc. RT, respiratory therapist, RN, nurse, everybody who's involved. Now, there are probably 10 people in the room when the addict homeless wife completely unprompted says she wants his organs donated but wants to save the penis for herself because his penis is perfect. What?
Who the starts a conversation like that? I just sat down.
The doctor was in his 60s and had seen some shit, so he handled it very calmly and professionally when he told her that wasn't something we did but could certainly look into organ donation. Completely unprompted. She said it completely unprompted. Is there a way to request your dead man's penis that is prompted? I don't know. Honestly, I'd marry any woman who said my penis was perfect. Shoot, any guy too. Line them up. Do we think it's the drugs that got to our head, or do we think this is just what every woman thinks about when they find a perfect penis?
Welcome to the ER. How can I help you?
I'm having a stomach ache.
When did it start?
Like an hour ago, after I swallowed a fork.
You swallowed a fork?
Yeah.
Why did you swallow a fork?
I wanted to see if I could do it.
What? Have you tried it before?
No.
You're sure you swallowed a fork?
Mm-hmm.
Okay, well, we're gonna need an x-ray just to be safe. Are you able to walk? Can you follow me?
Yeah. There is no way he swallowed an entire fork. You never know. I once had a pica patient who swallowed rocks and chunks of concrete. They can't help it.
Have you called psych yet, Ben? Not yet. I want to confirm the fork on the x-ray first. Oh, here it is.
Oh my god. What is all of that?
Sir, we got your x-rays back.
Do you see the fork?
Yes, we see the fork. We also see half a dozen coins, a toy car, and another object I can't even make out.
Oh, it's part of a TV remote. I knew it!
Rich! Sorry! Sir, this is very dangerous. You're gonna need surgery to remove these objects.
Oh, but those aren't bothering me. It's just the fork.
Sir, your pain is being caused by all the objects in your stomach.
No, those have been there for years. It only happened after the fork.
What do you mean, years?
I'm telling you, it's only the fork that's bothering me.
Alright, look. We can figure this out, okay? I'm gonna go get you some pain meds, and I'm gonna have some people come down to talk to you. Just don't move in the meantime. Okay?
Fine, but nothing except the fork is coming out.
That will be between you and the surgeon.
I am a paramedic. I picked up a patient, male, 27 years of age, unconscious. His female partner said they were shrimping right before he passed out. I don't know what that is. I looked up the definition of shrimping. It's where a man ejaculates into a woman's rectum. I'm gonna stop. Ejaculates into a woman's rectum, then inserts a straw and sucks out the semen and blows it back into her mouth.
I'm gonna go throw up now.
Yeah! Let's go! He passed out because she farted when he inserted the straw. That's what made you pass out? When she farted? I mean, a combination of like and cum in your mouth, probably. Yeah, that'll end you. Jesus Christ. People are sick! God, I wish I had a time machine to go back in time before I knew what shrimping was. That is crazy! Why is it called shrimping? That makes no sense to me. What happens if you come into the ER for passing out from your own cum and someone else's fart? I mean, I feel like if I was the one shrimping and the paramedics showed up and my boyfriend was unconscious, like, would I have to explain what I was doing? Just, he's unconscious. Just fix him. Why explain what was happening? Listen, was there semen in his mouth? Maybe that was why. She had to explain, like, I didn't kill him. He passed out because, you know, he was shrimping. Shrimping sounds like a fake term Law & Order SVU made up. That's what that sounds like. If anybody has any idea why it's called shrimping, comment below. Let us know, and we want a full and detailed explanation. My son, age 8, had found my husband's set of Leatherman pliers. Oh no. He hid them in his pocket so he could play with them later. On a car ride home, he was sitting in the back seat by himself and was holding them in his lap trying to open the pliers. When I stopped at a stoplight, he accidentally pinched his scrotum through his shorts. Oh no! The poor child. Must have scared the hell out of the mother too. I mean, he must have screamed. I had some explaining to do at the ER. Luckily, he only had a bruised testicle. Yes, Mom, you will have some explaining to do. Your kid somehow got into the toolbox and pulled out a very dangerous tool and put himself in danger. We will want to know how it happened, because from our perspective, the child is in danger at home. If the child is able to get into a toolbox to potentially pick up a dangerous tool to hurt himself, who's to say he won't get into something even more dangerous, like the medicine box, and potentially take some medicine that could really hurt him, which has happened. So we will need a very good explanation. You must convince us that your child is safe at home, or we will contact our social worker and they may or may not call Child Protective Services to do a little home visit.
Right to jail. No trial, no nothing.
Luckily, he only had a bruised testicle. Nothing worse. Luckily, he didn't lose a testicle at 8 years old, so. I worked in a long-term care facility around Valentine's Day when a survey circulated around the residents in January asking who was single and ready to mingle. This is just asking for it. Long-term care facility usually have patients who are a little older.
Elderly, sexy, furious.
I was then handed a shopping list that contained a huge condom order. Then on February 14th, the number of socks and bras on door handles was insane, like every other door, followed in the following weeks by an uptick in STD cases and the look on the attending physician's face as he makes his monthly rounds. Old people, get down. First of all, what happened to the condoms? You asked for a list of condoms and then everybody gets an STD. What did you do with the condoms? Use them for decorations?
Make balloon animals.
Old people get down. Yes, they do. No need for dentures. We're going full gums. Honestly, they asked for it, okay? They sent out a survey that said who's single and ready to mingle. Who's single and ready to wrinkle? These guys. Back in their day, it was called VD. And I'm not talking about Valentine's Day. For those of you who are shocked, don't be. Senior living facilities, nursing homes, old people in general get real horny. And they don't give a f about an STD. Their life is pretty much over. That's not true. They also, okay, yeah, that's true. That's one of the things. Of course they can't get pregnant, but the other reason is like, you know, they've lived. They don't give a about an STD. They probably have an STD before they were fooling around. It just happens. Old people don't clean their genitals, okay? Trust me, I know. I've smelled enough to know. I know. I'm an RN that has worked as an L&D nurse for 40 years. I was covering a coworker for her lunch break and of course got a brief report. The patient was a pre-MIP laboring with an epidural at 5 centimeters. A pre-MIP patient is someone who is giving birth for the first time. It is her first child and she has an epidural at 5 centimeters. She's got the pain shot and she's about halfway there to giving birth. The husband used the call light to request that a nurse was needed. I opened the door to find the patient naked, lying on her side with her back end facing me. She was not in apparent distress, and my first reaction was, wow, that poor woman has some nasty hemorrhoids. The next thing I knew, the hemorrhoids opened his eyes. That baby was beyond crowning. A wild delivery, but everything turned out well. I have often thought of writing a book, and the title of this chapter would be The Hemorrhoid Has Eyes. Jesus. How do you mistake hemorrhoids for a baby's head? And you've been a labor and delivery nurse for 40 years? Think it's time to retire, my lady. I'm glad her first thought was hemorrhoid, and not, holy shit, that is a big piece of doo-doo. I would never be in this situation. This is labor and delivery. I'm ER. I wouldn't even know what to do. Here's the thing, guys. Emergency rooms, we are trained to do a little bit of everything. So I have been trained to deliver a baby. Everybody has. Do you want us delivering the baby? Someone who's never done it before but has been trained? Or L&D nurse for 40 years who's probably done it multiple times a day but still can't tell a baby's head from a hemorrhoid?
It's a tough call.
15-year-old male was brought into the ED in the middle of the night by his mother with a chief complaint of abdominal pain, rectal pain, distension, and constipation. Oh my god. Distension is when your belly is swollen, so it becomes really hard to push down on. It's not good. Nurses had some suspicions about what might be going on because the kid kept pacing and refused to sit down due to the increased pain during the entire time he spent in the waiting room. Okay, so kid is able to walk. He's in pain, but I guess walking around is a good sign. Their suspicions were confirmed when they scanned his belly to find an entire glass mason jar fully intact. Oh my god. Mom didn't know until they pulled up the image on the computer to review the results with them. I have no idea how he managed to get it up there without breaking the glass or any details about how they removed it, but something tells me this wasn't his first offense. Yes, it's probably not his first offense, and it probably won't be his last. In my experience, kids who like to put things up their butt won't stop. So parents, if you have a kid who starts doing something like this, the best thing to do is just probably buy them an actual sex toy with a flared base and let them safely pleasure themselves, you know, with something that won't get stuck up their rectum. Oh my god, there's a picture. Oh my gosh, there it is. Happens all the time. Getting it out is the tricky part. You really don't want that thing breaking inside of you. That can potentially be very dangerous. I mean, they're kids. You were like this at one point too. Can't judge them. What you can do is help them. Isn't that what they say? You can't stop kids from having sex. You can only teach them how to have safe sex. And that fully applies here too.